Funerals provide closure to families when they lose a loved one, but with social distancing, people can't come together and say goodbye. Channel 3's Dennis House is here with more on how funeral homes are adjusting to all this. Dennis?
Mark, this is such a difficult time for so many people, especially those who have lost a loved one. How are funeral homes across our state helping families through this very hard time? Joining us now is Sheehy Jr. of the Connecticut Funeral Directors Association. Mr. Sheehy, thanks for being with us today.
Thank you, Dennis.
So, first of all, how is this impacting the funeral industry? Because normally, if someone dies, a funeral's scheduled within a couple of days. That's not happening, right?
Actually, funerals are happening in that time frame because we're not waiting for folks that come across the country to gather, because the funerals are being held privately at cemeteries now.
So, what is different than normal?
So it's different than normal. We're not able to obviously have a public gathering today. The other item that's different is we are making funeral arrangements via Skype, phone, email. So we're having less personal contact with our families, which is, I know, difficult on the families and difficult on us because we like to support them emotionally when we're together.
The funeral for the state's very first COVID-19 victim was apparently done outside through a drive-through type of operation. Is that happening with other funerals in our state?
No, I don't think so. I think that was the only case that I've heard of that has been outside.
What kind of precautions are funeral home workers taking if they should go to a home where someone suspected of having COVID-19 has died?
We have the same personal protection equipment that they use at hospitals. So we are using them when we're going to homes, going to convalescent homes and going to hospitals. That's a little different than I think we normally would do when we make a removal with masks and gowns and face shields and shoe coverings. So that is a little extra precaution that we need to take when we're making a removal.
We've heard stories out of Italy and that they don't have enough room to put all the bodies of the people who have passed away. They're making makeshift morgues in New York. Do you anticipate a situation like that here in Connecticut? I know it's difficult to predict, but are we prepared for something like that?
Yes, it is difficult to predict. I know the medical examiner's office is prepared. They've been in contact with the Connecticut Funeral Directors Association, and they do have a plan in place if we do get to that point. I know because of we don't have to wait for a funeral to take place 3, 4, 5 days. We can actually expedite the services and have the burial or cremation take place faster than normal because the immediate family is local, so we can actually expedite those services for them.
Sheehy from the Connecticut Funeral Home Directors Association. We appreciate you joining us tonight. Thank you.
Thank you, Dennis. Thank you.